Hi, this is Dr. Benzinger on Health with secondopinion.org. Welcome to our program and our educational session on vitamin B12, very important nutrient. B12 is probably one of the more important nutrients simply because it's so hard to get into the body, and common nutritional deficiencies associated with B12 exist in the United States of America. First thing I always cover is natural form comparison to synthetic form, because the more natural form is a more complete form that normally is better for the body. Unfortunately, sometimes the natural forms are extremely expensive. The natural form in this case is called cyanocobalamin. Cyanocobalamin. It is very expensive, to the tune of, what do they say, per pound, per whatever, up to 1,000 times more expensive. So finding anything that's got any mixture of cyanocobalamin is a great source if you can find it, okay? But most of the time you're going to find it in the form of something called hydroxycobalamin, which is most common used just simply because it's so much cheaper. And cheaper doesn't mean better, doesn't mean worse, but in this case has a tendency to mean not as good, okay? First thing I'd like to cover is just what a vitamin is and what's its role. A vitamin is an organic substance that is vital for your life. Majority of vitamins cannot be synthesized in the body, thus the diet or supplements must supply the needed vitamin. If it doesn't get supplied, you're going to be deficient, and over time it is going to make your health suboptimal. Okay, it's a water-soluble vitamin. It's very hard to become toxic on it. I don't know if there's been any cases, but I'm sure it would be very difficult to be vitamin B12 deficient. Okay? I always show this picture. If you look on the left-hand side, you look at ascorbic acid on the top and natural vitamin C on the bottom. Do you see a difference? You should. Should be a stark difference in color between the top and the bottom, because ascorbic acid is not vitamin C by itself. It is one component of it. We have sold you the idea, not me, but in the commercial industry has sold you the idea that you get ascorbic acid, you got vitamin C. Let me tell you, that's not true. Vitamin C is F factors, P factors, rutin, bioflavonoids, hesperin, all kinds of important stuff. You're not getting it when you get it in this form. Guess what? That's natural comparison to synthetic forms and almost everything we're going to cover, just so that you know. Okay? It's important to know. We talk about synergists. Okay? Synergists are those nutrients that are necessary to be present at the same time to get the most benefit out of the nutrient you're taking or eating. And calcium, vitamin C, and vitamin E are those elements when it comes to B12. So calcium, vitamin C, and vitamin E, you want that to be present in hopefully the nutrient you're taking, such as a multiple vitamin, if it's high quality, not just vitamin C, that's ascorbic acid too, remember that. So we get the points of view. We want you to get as much from food as you possibly can, because if you don't get it from food, you're probably not going to get the whole complex. I don't care how I put together nutrients. Look at broccoli. Do you think it's going to be possible that I'm going to give you a nutrient that's going to supply everything that's in broccoli? How about an apple? You think I'm going to give you a nutrient that's made with all the things that are necessary to be part of an apple? Let me tell you, not only is it impossible, but you talk about cost prohibitive, ridiculously large, and you'd be taking dose after dose after dose just to get what a natural apple gives you. Let me tell you, it ain't going to happen, not in this day and age. We got a long ways to go. So we want, when we do give you supplements, we need to know that you're eating good quality diets in combination with it, and you're going to get the greatest benefit out. The idea that I'm going to pop a few of these pills and I'm going to eat whatever I want, let me tell you, look at the apple. You have no chance. Okay? In the body, what we know is it's needed to prevent something called pernicious anemia. It acts with folic acid, which we've covered in another seminar, to help regulate RBC, red blood cell formation. It helps utilize iron required for proper digestion and absorption of foods. Iron's not all bad, it just needs to be used right in the body. It's necessary for normal development of your red blood cell and healthy function of all cells. Every cell's normal function is dependent upon enough B12, and for you to replicate and make other cells, B12 must be present, particularly in the bone marrow, nervous system, and intestinal tract. When we look at deficiencies, you might see slower or poorer reflexes. Sometimes they'll say that, well, you're just getting older, you're getting slow. I've seen 60-year-old people that are quick with their hands, with their feet, because they got enough B12 in those cases and have taken good care of themselves. Chronic fatigue, depression, constipation, poor memory, pins and needles, that feeling in the limbs, and moodiness. Some of the general conditions, disease processes that might assist B12: asthma, arterial sclerosis, bursitis, Crohn's disease, depression, diabetes, high cholesterol, infertility, specifically in males, osteoporosis, pernicious anemia, and vitiligo. Okay? When we look at food sources, beef, eggs, fish, specifically herring and mackerel is really good. Kidney, organ meats, milk, dairy. And the best vegetable sources are sea vegetables, such as dulse, kelp, kombu, and mori. The risk groups: vegetarians. I can tell you when I'm going to look at somebody's blood work, I can pretty much tell you who are vegetarians and which not. They get very specific patterns. I can also tell you in geriatric populations, because they showed the same pattern because they have such malabsorption issues. They've got to really be aggressive on B12 or folic acid. Let me tell you, there's lots of patients that we've had over time that once we get their B vitamins up and get their B12 and folic acid together, it's amazing how many symptoms get better in 60 and 70 and 80 and 90-year-old people. Nutrition is a huge issue in the geriatric population that is totally unaddressed in this society, and it's frightening. It's silly. You're talking about inexpensive approaches to something called wellness and well-being that needs to occur. Okay? So digestive disorders, another risk group. Those that are taking antacids are almost guaranteeing folic acid and B12 deficiency. Absorption is blocked by potassium supplementation. If you're taking diuretics and then you're taking potassium supplementation at the same time of the day, you're blocking your B12 absorption. You might want to keep that in mind. Anticoagulants, anti-gout medications, and absorption impaired by low thyroid function is another issue. Other medications that are of issue: antacids, antibiotics, colchicine, Ceclar. Most antibiotics, Ceclar is just one of the groups. Oral contraceptives move you towards B vitamin deficiency, and there's many, many others we can't cover, but this gives you a good taste of it. So if you're on any medication, one of the things that you want to know is which ones are inducing what type of nutrient deficiency. All too often somebody gets started on a medication. Then they start having other conditions. It is not infrequent that it's the nutritional deficiency induced by the first medication that's inducing the other symptoms that you either get another medication for, or if you get a very wise, smart doctor that is very advanced and is really thinking, they'll say, oh, you know what? We've been giving you this antacid. You might have folic acid and B12 problems. That might be why you're tired and your red blood cell formation is not very good. Let's look at supplementing that at a different time of your antacid and see if that helps. That would be brilliant. Does it happen much? No, but there are some doctors out there, I just love them. They're really advancing. They're not just passing out the medication, not thinking about it. They're really working hard. Okay? Depletion by too much vitamin C, such as 5, 6, 7 grams a day, can occur. Okay? It's destroyed by too many acids, alcohol, water, sunlight, and aspirin, or anti-inflammatory medications, can create a real problem. Okay? So just realize that we look at the RDA's recommendation of 3 to 4 micrograms per day. First of all, it's a highly unabsorbable nutrient. We have lots of factors affecting us, and if you've not gotten our seminar on Secrets to Vital Health, that seminar poignantly documents why the whole idea of an RDA might be a really big issue. And the reason why is an RDA keeps you alive. It doesn't help you thrive. In other words, if you've got stress in your life or you live in this society, you're using probably more B12 than what's here, except for in unique cases. You might want to think about, in your own case, making your own decision. I'm not making recommendations. I'm just letting you know. Look at that seminar. Make your best judgment for your health. Dr. Benzinger's advanced information on blood and blood vessels is best known for its role in making red blood cells. Okay? When B6 and folic acid is added to this, homocysteine levels get lower, which means osteoporosis and cardiovascular disease is reduced. Remember, if we can help you prevent the cardiovascular incident or disease process, think of what we've done. One stop in the hospital for bypass surgery, you tell me what that is? $250,000? If you could take 1/20th of that and put that towards your health over the next 20 years, wouldn't that be worth just not going through all that? And the fear of the next incident is so overwhelming, it's amazing. Look at the nervous system. B12 is involved in the production of the myelin, which is the sheath, the plastic covering of your nervous system that is important for being calm and relaxed. Those are anxious, irritable, edgy all the time. B12 might be a major issue. Mild to severe emotional neurologic conditions can result from deficiencies of folic acid and B12. In cancer, B12 may play a large role in cancer prevention, but many times it's just totally unaddressed. Okay? When combined with vitamin C, they have shown the benefit in inhibiting formation of certain types of cancer cells. So, vitamin C, B12, almost no side effects for either. Might be something to consider. Okay? So what's its possible benefits to asthma, arterial sclerosis, bursitis, Crohn's disease, depression, diabetes, high cholesterol, infertility in male, osteoporosis, pernicious anemia, and vitiligo? Well, you judge for yourself. If you're on medications that might induce it, you judge for yourself. If you eat a poor quality diet on a consistent basis, more than likely an issue. If you've not registered at secondopinion.org and put in your email address so that every week you'll know what we're covering on there, please do so. Go to secondopinion.org, put in your email address, and at least you'll know every week the books we're covering and the information such as this that hopefully you can share with yourself, with your friends and your family to save lives and prevent disease in the first place through these processes of learning how to take care of yourself. We hope today helps. This is Dr. Benzinger on Health with secondopinion.org, and may God bless you.